Okay, hi everybody. Welcome AACA members. I'm so excited to welcome you here to the Healthy Start presentation. For those of you who saw us in Vegas, I hope that you are beyond excited. For those of you who missed it, I'm so excited to offer the same presentation here for you now so that we can get started and catch you up to speed. I'm here to talk about Healthy Start, which truly and sincerely is a dental solution to a medical problem. A few disclaimers before I get started. Healthy Start by Orthotane. I'm a Healthy Start by Orthotane clinician and lecturer. I am being compensated for this lecture. The advice and outcomes that I'll be talking about here today are based on peer-reviewed research and clinical experience. If you'd like more information, please go to thehealthystart.com to learn more about it. All right, so let's start from the beginning. What is sleep disorder, sleep-related breathing disorders? The ADA defines it as any disruption in normal breathing patterns. Serious medical conditions caused by anatomic airway collapse and altered respiratory control mechanisms, snoring, upper airway resistance syndrome, and obstructive sleep apnea. They've all been associated with very serious metabolic, cardiovascular, respiratory, dental, and other diseases. So in children, undiagnosed or untreated OSA can be associated with all kinds of things, all types of systemic problems and behavioral problems that are affecting them for a lifetime. So what we're going to do today is not only define sleep-related breathing disorder, but we're going to talk about how to recognize the outward signs and symptoms of SRBD and then how to treat the root causes in order to help this child have a much healthier lifestyle. So in 2017, the ADA came out with a new position paper, which is exciting because we know, regardless of how you feel about the ADA, it is our governing body. It is our governing board here, and we like to take initiative from them and follow suit. So it's really interesting. In 2017, their position paper said that in children, screening through history and clinical exam may identify signs and symptoms of deficient growth and development and other risk factors that may lead to airway issues. So this is the very interesting part. If there is a risk identified, it is now necessary and standard of care to either help treat that patient or to make the appropriate referral. So no longer is airway or sleep or these types of symptoms something that a small group of dentists look at. This is now standard of care for everyone to look at. So are you going to be the doctor who refers these patients on to someone else to help them? Or are you going to be the doctor that identifies a problem and then actually fixes it while the patient is in your office? I'm here to tell you, hey, be the doctor that helps these kids. We know that an estimated 9 out of 10 kids suffer from one or more of these symptoms. So if you have children in your family, if you have children in your practice, or even if you have adults in your practice who have children, chances are they are being affected by these outward signs and symptoms. So what symptoms am I referring to? Mouth breathing, snoring. Snoring isn't necessarily old grandpa in a rocking chair that has this big, loud snore. Snoring is any type of audible breathing that they have. Tooth grinding, crooked and crowded teeth, swollen adenoids and tonsils, chronic allergies, ADD, ADHD, aggressive behavior, irritability, anger, depression, peer problems, difficulty making friends, bedwetting, difficulty in school, especially in subjects that require higher levels of concentration, like math and science and spelling, delayed or stunted growth, restless sleep. You lay a child to sleep, the next morning their sheets are all over the place, their stuffed animals are thrown all over, nightmares, morning headaches, daytime drowsiness, frequently waking up throughout the night, or sleep talking and walking. I will tell you, this is the silent crisis among American children. If we can identify these outward signs and symptoms of these children and have a conversation with the parents about how do we treat the root cause of this rather than treating these symptoms, I guarantee we're going to set these children up to have a much healthier start long term than if we don't. So as the brilliant philosopher Taylor Swift once said, these conventional treatments address symptoms only. Band-Aids don't fix bullet holes, ladies and gentlemen. We don't want to put a Band-Aid on the teeth grinding. We don't want to put a Band-Aid on their drowsiness. We want to fix the root cause and watch all those outward signs and symptoms completely resolve and improve for making a long-term change. What are parents looking at? What are some of their other options? Commonly prescribed options for parents. When parents come into my office and with their children who are presenting with these symptoms, typically they've already had pharmaceuticals prescribed, they've had testing, counseling, play therapy, they've already had surgeries. surgeries including removal of tonsils and adenoids. We've seen rhinoplasties here in Dallas, Texas. We've even seen posterior tongue reductions in some patients that the doctor, the surgeon, the ENT has said that your tongue is too large, it's blocking your airway. Let's cut that tongue away to open your airway. So some pretty invasive surgical options that these children have either already gone through or have been presented with, and the parents are really looking for other options. I've seen children, it's common to hear that these children have had sleep studies in the hospital, allergy testing, special education tutoring, sleep aids, everything from essential oils to vitamins to prescription sleep aids that they're on. Diet changes, we've had the gluten-free, dairy-free, sugar-free, vegan, all types of diet changes that parents are trying to use in order to help. Rapid palatal expanders, and all types of prescription drugs. What I found though, not only as a mother of 4, but also amongst the patients and the parents in my practice, is that most parents are looking for a non-pharmaceutical, conservative, successful approach that's predictable and easy to do. And a lot of the options that they're being given by other providers don't fall under those categories. So what are the root causes or symptoms that we're going to look for? Dun, 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 that was a very dramatic opening, right? What are the root causes of these symptoms? Well, I will tell you, and let's figure out which medical provider would be the expert in this. So research over the past 25 years has linked each of these symptoms to a root cause: mouth breathing, a narrow palate, improper tongue placement, or jaw relationships. So if we look at those 4 root causes, what type of provider would you consider to be the expert in this area? I think hands down it's a dentist. As a dentist, we are looking at these things all day long. We're looking at how the child breathes. We're looking at the palate. We're looking at how the teeth fit. We're looking at the occlusal relationship. We're looking at the tongue. A lot of times we're battling the tongue when we're trying to do dentistry, so we're very well aware of where that tongue is and if it's in the right position or not. We're also looking at jaw relationships. We're looking at the TMJ joint and the upper and lower, the maxilla and the mandible, and how they fit together. So it is in my opinion that more than any other provider out there, dentists really have the expert knowledge and the skill, the care, and the judgment to be able to really treat these root causes. Let's dive a little bit deeper and talk about what the solution is. The solution for those 4 root causes that will, if we treat those 4 root causes, that will then resolve and improve to begin with, but then completely resolve those outward signs and symptoms, is HealthyStart by Orthotane. HealthyStart by Orthotane is a series of non-pharmaceutical early intervention appliances that are worn by the patients at night only, for the most part, that help correct habits as well as guide teeth into the proper position to really help. Let's look more specifically. With HealthyStart, you'll be able to screen, identify, and evaluate the underlying root causes associated with it. So just like that ADA policy released in 2017, just by becoming a certified HealthyStart provider, you have now kept in tune and been in line with what the ADA is saying is now standard of care. You'll also be able to take it a step further. You'll be able to address airway issues, eliminate poor oral habits that these children are presenting with. You'll be able to promote the proper growth and development of these children. So by eliminating the poor oral habits, we can then put the child back on track to have proper growth and development for up until that is complete at the onset of puberty. We can correct many orthodontic conditions that are directly associated with sleep disorder breathing. We can guide incoming adult teeth prior to PDL fiber maturation. So we're putting that tooth in the correct position as it erupts, and we've eliminated habits that would then cause that tooth to be in an altered position after we put it in the right place. And we're going to create beautiful smiles for a lifetime of good health. That's the most fun thing ever. If you can actually correct habits so that these children feel better and they sleep better and they function better, and then they have this beautiful smile so they can walk around. I'll tell you what, that's a great day at work. It's one of my favorite things. It's absolutely my favorite thing to do in my office, way better than doing a root canal. So how are we going to do this? How are we going to start to evaluate these outward signs and symptoms? There's an initial screening tool that you can use, a sleep questionnaire in our office. We treat this just like any other piece of the medical history. So as they come in and fill out new patient paperwork, or they update their medical history for our existing patients, as we introduce this into our practice, we use this initial screening tool and have the parent fill it out. What this does is it allows us to look at what the parents are seeing with their children. Now, we're looking at everything from snoring to stoppage of breathing to mouth breathing, hyperactivity, excessive sweating, nightmares, talking in sleep, restless sleep, teeth grinding, bedwetting, speech problems. The list goes on and on. There's actually 39 different symptoms that are listed here that we ask the parent to look at. What's interesting about this is a lot of parents can fill it out, no problem. I know exactly how they sleep. Wonderful. That gives us great feedback, and we can then start the conversation about how we don't want to treat these outward symptoms that they filled out positively on this form. We want to fill out the root cause that will then allow us to resolve these outward signs and symptoms. It also just begins the conversation with the parents. So maybe they have no idea. Maybe they tuck their little kid to bed and they close the door and they sneak out only to have them wake up in the morning, right? So this starts the conversation for them to maybe sneak in and peep at their child and see how they're actually sleeping, or really consider, hey, this awesome kid that you have, or this struggling kid that you have, or whatever category their child might fit into. This really lets them take a look at it and say, how could we improve that? What are they really struggling with? Parents are very excited about this questionnaire. I'll tell you, when we first introduced this into my office about over a decade ago, parents wanted to know, what do you mean, do they wet the bed? You're just the dentist. How can you help me with that? Well, great question. Here's how. We're going to treat the root cause of the bedwetting so that resolves. How does that sound? Great. I've seen 10 other, no one's been able to. Those type of conversations happen very organically, and it really creates a lot of excitement and buzz within the office when we do that. I'm excited for you guys to introduce these into your practice, introduce that questionnaire in your practice as well, so that you can have these same types of conversations. I'll tell you, it's inexpensive. It's a piece of paper. You can print it out, they fill it out, and it really creates a lot of buzz. So it's a very easy action item to take from this brief time we have here together to start introducing that questionnaire. And I guarantee you'll have more people asking and talking about you in your office than any other procedure you have done, even Invisalign. So there was a great study that came out that talks about the incidence of sleep disordered breathing symptoms in children from the ages of 2 to 19. And this was published in the JAOS Winter 2016 magazine or issue. And what was really interesting that they found in this article is that 90% of children exhibit at least one symptom. That's where the 9 out of 10 comes from. But here's what's really wild. 60% exhibit 4 or more of those symptoms. My goodness, I hope you guys are like, yelling at the computer, like, hey, if you start to think about it, it makes sense. If someone is mouth breathing, if they're taking in improper levels of oxygen and their body isn't functioning properly, if they have an underdeveloped mandible and their airway's blocked, they're going to bring their jaw forward to try to grind their teeth to keep that airway open. If they're taking in lesser quality air through their mouths, forcing their tonsils and adenoids to filter and purify that air, which they're not supposed to do, of course, they're going to have an increase in inflammatory reaction that may mimic allergies. ADD, ADHD, if a child isn't getting restful, deep sleep, instead of being like me, when I get tired, I just want to get horizontal and binge watch Netflix. Children aren't that way. When they get tired, they get overtired and start carrying on. They have restlessness and they have behavior that may mimic ADD, ADHD. So perhaps that's being misdiagnosed. It definitely begs us to take a closer look. We also see bedwetting happening very often. So a lot of these symptoms that we're looking at, with the incidence of these symptoms being so high, these parents are out there, they're asking the questions, they're begging for solutions from all types of different providers. So it's really exciting is now we as dentists, as certified HealthyStart providers, we have the solution, we have the answer. And parents are going to be very excited about that. So the results are that mouth breathing and snoring are the most commonly associated with sleep disorder breathing symptoms than any other symptom studied. Again, mouth breathing and snoring are snoring is any type of audible breathing through your mouth. Like I said, it doesn't have to be, and I'm not going to dip this on the presentation, but it doesn't have to be the guy on the plane that's like, sawing logs as he's sleeping there. It's any audible breathing. So I had a patient the other day that talked about how she was so concerned about her son that had daytime breathing or snoring. It was just audible breathing during the day because he was breathing in and out through his mouth. If you say it that way, you'll figure out how many children actually are mouth breathers. You'll see them on the playground. You'll see them in the classrooms. Their mouths are always gaping open. Another takeaway from this study is 9 out of 10 children had one or more symptoms of sleep disorder breathing. I know I'm saying that over and over because it just astounds me how many children have this. And it probably starts with your own children. If you were to go home and take a look at it, I hope that your child is the 1 out of 10, but chances are they're not. Or chances are the children of your team in your office, chances are someone in your office is dealing with these symptoms every day. So how great is that you could resolve it? 60% of the sample had 4 or more symptoms. So most kids aren't just struggling or adapting with one symptom. A lot of them have a lot more than that going on. Here's another wild one. 1 out of 5 children experience bedwetting. So when you have an 8-year-old or a 10-year-old or a 12-year-old in your office and they're ashamed or they're embarrassed to admit that they bedwet, you can say, hey, listen, dude, don't worry about that. This is very common. And by the way, you have no control over it. So there's nothing to be embarrassed about. There's nothing to be ashamed about. This is how your body works. We just got to change the way it works, get it functioning a little bit different, and that'll go away. So don't even worry about it. One thing that's so rewarding is you just see these children kind of take a deep breath and relax. It's also very common when I say this to a child who's bedwetting, who's, older, a little bit older than is socially acceptable to wet. I'm like really throwing out the air quotes today. I hope you guys are appreciating them. But when you throw, when they talk about it and you say you may have a solution, it's amazing how transparent the parents get. I had a dad tell me this week, actually I also wet the bed and I still wet the bed. And I'm like, well, Dad, thank you so much for being so brave and admitting that. But let's focus on your son. We can focus on you during another appointment. But they get excited when they think, hey, maybe you have a solution. You're not just going to refer me, or you're not just going to, send me to Amazon to purchase, the bedwetting alarm. That thing is wild. If you don't know what I'm talking about, get on Amazon and search for this bedwetting, all the products that are aimed at parents to help their children with bedwetting. It's alarming. And here's another one. Between the ages of 4 and 12, 93% of symptoms did not self-correct, while 30% actually worsened with age. So when I first started doing this, I really kind of went head to head with a lot of the pediatricians about teeth grinding and bedwetting. And the pediatricians were telling the patients that we co-treated, don't worry, you'll get better. Don't worry, you'll grow out of it. Don't worry, I don't have a solution right now, so I'm just going to tell you to keep going and maybe it'll get better. And we've really changed the conversation in my community that, hey, pediatrician, you don't have to have all the answers. You don't have to have all the solutions, but you need to have all the facts. And a fact is 93% of these kids are going to get worse. So if you don't have a solution, find someone who does. So it became a great referral source for me when these pediatricians said, hey, listen, this bedwetting is an issue. You may grow out of it, but probably not. 93% of kids don't. And actually 30% get worse the older they get. So let's refer you to a certified HealthyStart provider who can help intervene and help establish proper oral habits and get you back on the path that you need to be. So you're now going to be empowered with this information, and I hope you feel this responsibility and this passion to go share this with everyone in your community. Of course, I love the referrals. I'm not going to lie. This is an easy thing to do. These appliances and working with these kiddos is easy. It's fun. But I have to tell you, it's also very profitable, and it's a great way to get referrals because some of these other providers in my community do not have the solution that parents are willing to sign up for and partner with. So it's been a great practice builder as well. So let's talk a little bit about the root causes and how we're actually identify it. The poor habits. We're specifically talking about an improper swallow, poor tongue position, and mouth breathing. So ideally, when you breathe, you have your lips together and you breathe in and out through your nose nice and easy. If you see a child with their mouth open, or if you see a child with their lips closed, but they're really straining to gain air, or they're flaring their nostrils, right? That is not a great oral habit. And it's also not a very flattering demo. But anyway, well, what the things I do for this group. The other issue that you want to take a look at is their improper swallow. We know that when someone swallows, we want their tongue to go up to the top of their mouth, and they just want to see the muscles of their neck move as they swallow. So here's my demo here. Right? You only saw the muscles move. An anterior tongue thrust or an improper swallow, you'll see the child recruit muscle fibers around their mouth or within their face to really form that seal so that they don't spit the liquid out. We know that if they have an improper tongue position during swallow and they recruit muscle fibers that aren't supposed to work, that can actually restrict the growth and cause problems as the teeth erupt. So that's something that we really want to correct early on. The cool thing is that HealthyStart has an appliance. I'm going to talk about it here in a minute, so I don't want to spoil it now, but it has an appliance that can actually correct the swallow at night while the child sleeps. The other root cause, the narrow arch, improper growth and development that is developing because of these poor oral habits. We then see a deficient lower third of the face, And then we get orthodontic problems, not because the teeth are too big, but because the mandible is too small. The mandible is underdeveloped. We see that with the lower, when we compare the upper, middle, and lower thirds of the face, we see that mandible is underdeveloped and there's not enough room for the teeth. The teeth don't line up properly. When you sign up today for the certification course and to become a HealthyStart certified provider, I will reassure you, we go through identifying these root causes for quite a bit of time. We really equip you with more details. This is just an overview that we're providing today to really entice you to come and learn more about it. So I will say something that's really important to remember, and maybe you guys do, I didn't always remember this from dental school, but we know that the natural growth and development of a child is in a downward forward direction. So I'm not looking to make little Jay Lenos here with these big old chins, but we want to bring their growth downward and forward. We know that by the onset of puberty, let's call that 12 years old, that about 90 to 95% of growth is completed in the boys versus the girls. So we have this golden opportunity between the ages of 2 and 12 to make a permanent change, to really guide their growth, to set them up with proper oral habits, and then guide their growth where they're supposed to give them this great start. A lot of times traditional orthodontists will wait a little bit, and by waiting, and I know there's more early intervention and there's more solutions, but I will just say this for simplicity's sake. I will say the issue with waiting is that we lose some of this natural growth and development that happens as soon as in a 2-year-old. So these appliances can be used in a 2-year-old very effectively. My youngest patient is 18 months. So it really depends on the child and the parent, quite honestly, to see if they'll be compliant with it. But when I explain this to parents and I say, listen, this is the time to do this, I'm not getting a lot of pushback. I say, here are your issues. Here are the outward symptoms that we're seeing. Here's the root cause of it. And here's our solution to eliminate the habits and then get them back on their natural path of growth and development, to set them up for a stable lifetime. Parents like hearing that. They like hearing that, yeah, I grind my teeth too, or I have malocclusion as well, which is why I'm doing Invisalign. I know you guys have a ton of Invisalign patients in your practice. What's really exciting is you can change that conversation. Hey, we have this beautiful Invisalign case that we did on you. You have a beautiful result. The AACA doctors are insane with Invisalign. The cases and the successful cases that you guys are turning out are amazing. I'm so excited to see them. So you can really turn the conversation and say, as beautiful as this is, and as easy as this was, since we're all Gallerites and we know the best methods for Invisalign, you can change it by saying, don't you want different for your child? Wouldn't you like your child to have to avoid even doing Invisalign at a later age? We can set them up to potentially avoid that by really changing their habits and timing it with their natural growth and development. So it becomes a very easy and convenient way to educate these patients that are already in your practice and then get a call to action to bring their kids in to get them started. Because for the most part, parents want better for their children. Now, if someone says, no, I don't want any better for my child, they'll be fine with traditional braces. Great, they're not in our lane, not the patients we want to work with anyway. So this is a great way for you guys to turn these Invisalign cases that you're churning out, over and over and over, turn these into potential referrals. So we talked a little bit about mouth breathing and what that looks like. We know that mouth breathing while sleeping causes airway constriction. So it really closes the tube that connects the outside world with your lungs inside. We also know it doesn't improve. I'd like you to watch my buddy Eli here breathe. He's sitting in his car seat. He's parked safely. And I'd like you to listen to what he sounds like as he breathes.
Now he's holding it. That was holding it. He's still holding it. He's trying to take in air. There he goes. What? He's holding it. He's holding it. He's still holding his breath, and he's going to gulp again. There he goes. That was it. And again, he's holding. He's holding. He's trying. There he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had.
Now we've cut the video for convenience, but I'd like you to notice how he's flaring his nostrils and how he's really struggling.
When I take his jaw, And it just brings it forward.
As she brings his jaw forward and opens his airway, I want you to notice how the musculature of his face changes and how his nostrils even change.
Just bring his airway forward. Now listen to the quiet breathing. There we go.
So you can tell that before and after, it's two different children. The quality of rest and the type of sleep that the child's getting as a mouth breather is very different than the child that has a proper airway and is able to breathe properly through their nose. So while this mother is incredible and is pulling,
through his nose quietly,
bringing and opening the airway, of course this isn't realistic to do with our children. What I will say from this is, as you get started as a certified HealthyStart provider and you're encouraging these parents to evaluate their child's sleep, give them your cell phone number. Allow them to send you videos of their children sleeping so you can look at it. What you'll find is most parents do not actually send you the video. Most of them won't even bother you on your cell phone, but what they'll do is they'll take the video and they'll watch it themselves, and then they'll call to make an appointment to have their child evaluated. So when we're talking about this, just for reference on these cephs here, these are two different 5-year-old patients. We have a restricted airway on the left and a normal airway on the right. You can see the difference in how big they are. The effective mouth breathing here on the left, we have a normal airway, but when the child mouth breathes, and this is about a 1/2 inch of an open mouth, look how much smaller this gets. It closes the oropharynx 7 millimeters. So in a 7-year-old, the average size, the normal size of an airway is 7 millimeters. So a normal size airway with a mouth breather, they've just closed it to a 1 millimeter airway. You can imagine how detrimental and how much that could change. With the habit corrector, which is the first appliance of the HealthyStart appliances, the child on the left has a very small airway, but with the appliance in place, you can see how it actually positions the jaw in an anterior position forward and actually opens that airway. Now, the habit corrector is something that's worn at night and worn passively, but it actually drives the growth of the lower jaw with the goal of these kids are not going to be appliance junkies for the rest of their life. They're going to wear the habit corrector while they naturally grow and develop. And then once we get them in a stable position by erupting the teeth, guiding the teeth into the proper position, they won't need an appliance anymore, and they will have this nice developed airway. So this is one of the kiddos I see in my practice. He has Down syndrome, great kiddo. We're going to watch him breathe here on the left. So doesn't sound good. You can see him straining. This is his first night with the appliance. He fell asleep on his mom's chest here. His mom is actually a medical doctor, so she was interested. She wanted to hear. They normally sleep together because he would hold his breath so much that he would stop breathing, and so she would shake him to wake him up. So she was able to put the appliance in, and I want you the same day, the day appliance, I want you to observe the differences that you see just by having the appliance in. The child is straining less for air. We still don't have great lip seal, which he'll work up to. And actually, this video is about 6 months old, so I will tell you he does have proper lip seal. He does have Down syndrome, which is stereotypical. Those patients present with a forward tongue posture. He has improved his tongue, no longer has an anterior tongue thrust. And that took us about 4 months working with him on that. Okay, good. So how do we explain compromised airways to parents? This is one thing I like to do. I talk about a severely compromised airway being the size of a coffee straw. And then I talk about the ideal airway being something more like the diameter of a garden hose. So which one would you rather your child breathe through, a garden hose or a coffee straw? And most parents say, well, yeah, a garden hose, that makes sense. I say, great, your child is breathing through a coffee straw. We need to open it and develop it. That makes sense. Parents respond well to it. Of course, you wouldn't expect for them to breathe well if they don't have the proper tools and they're not built the right way. So with HealthyStart, every treatment starts with the habit corrector. There are different sizes. There are different appliances to use based on size and the dentition that's present. So the habit corrector has different features that really address these symptoms. For example, if we look at the appliance up here on the upper left, we see that there are palatal tabs. The great thing about the habit corrector, and the thing that I'm most proud of when I'm educating the parents about why this is so important, is because it's actually using the natural force and the natural pressure of their teeth to achieve these things. Rather than cementing a metal force or turning a screw or cranking, however you want to describe it, we're actually using natural pressures of their teeth and of their tongue to achieve results. Parents really like that. It sounds more conservative and it sounds more natural. So we have these palatal tabs, and with tongue pressure, with every swallow, it expands it. I really encourage you guys to visit the HealthyStart booth at any trade show that you attend so that you can feel these appliances and really get to know them. There's a pull tab here that helps strengthen that you can do some myofunctional strengthening exercises with it, which is wonderful. You can also attach it to their pajamas in case it falls out as they're learning to wear it. There's maxillary prongs, as we see here in the lower left, that help retrain the tongue to swallow in the proper position. We have lingual tabs that prevents the mandible from falling backwards to really keep their airway open. So really a genius appliance that addresses all of these things. And they wear it at night. So most patients, or one of the biggest questions that doctors say is, my goodness, how am I supposed to get this child to wear the appliance? How am I going to get a 2-year-old to put the appliance in? And I'll tell you, at first, maybe they'll wear it a little bit during the day. Maybe we'll find a 5 or 10 minute interval before bedtime or during bath or screen time or all kinds of things to help them get used to it prior to introducing it at bedtime. The very cool thing about HealthyStart is once you become a certified provider and you turn in a case, you actually receive a customized treatment plan for every single patient based on the information that you submit. So you'll get these tips and tricks, and they'll really hold your hand as you walk through and you begin treating these patients. Let's talk about rate of swallowing, and let's talk about myofunctional therapy, because that's also another hot topic. Okay, so how do we get the kids to wear it? We've kind of talked about that, and with this customized treatment plan you receive. Well, what if your child is doing something else? Let's talk about how much they swallow. So let's say daytime they swallow about 2,000 times, because they swallow about 2 times a minute, right? At nighttime they swallow about 1 time a minute. They're sleeping 8 hours. Hopefully they're sleeping more than that, but we'll be conservative for this demonstration. So we're getting about 2,400 swallows a day. With the habit corrector, if they're wearing it during the day and at night, you're getting correct swallows, about 720 correct swallows, which is amazing. With the myofunctional exercises only that are given to you, you have to make sure your tongue is going in the right position, because it's sometimes easy to cheat on those, and I speak from experience. But not only do we want them to swallow properly, we're only getting about 28% of what the habit corrector does in a typical myofunctional therapy session. So if I have someone with a very strong habit, a very strong anterior tongue thrust that's affecting their speech and affecting the way they eat, I love partnering the two together. I love having a myofunctional therapist work while they wear the habit corrector. And the same goes with speech therapy. And the feedback that I get time and time again in working with these wonderful therapists, speech therapists, myofunctional therapists, et cetera, is, wow, I can't believe how quickly we were able to see changes. I can't believe how quickly we were able to resolve some of these habits. And I really think that's because they did get a little session with the therapist, but also they got all these additional proper swallows or proper functions after the fact at night while they sleep. So that's really wonderful. When a child is a mouth breather and they're breathing through the mouth, it's hard to tell them to change. It's an autonomic thing that is controlled by your brain. So if we can get them to just simply fall asleep with it and manage the expectations of the parents to say, hey, they may spit it out for the first couple of weeks. They may spit it out for the first month. That's okay. They're going to continue to wear it until their body gets used to it. Kids do what feels good. It gets them in trouble when they're teenagers. But at this stage, with these 2 to 12-year-olds, we can really take advantage of that. And it feels better to breathe through your nose. It feels better to swallow this way. So very quickly, their bodies adapt. Especially in young, healthy kiddos. So that's always very exciting. So what is HealthyStart? I've touched on a lot of different things. Let's kind of sum it up so you can really wrap your brain around it. It's a simplistic system utilizing only 2 to 3 appliances in most cases, taking the child from the age of 2 all the way up to 12 or the onset of puberty. It includes a comprehensive treatment plan with no guesswork and ongoing support. So not only do you get a comprehensive treatment plan with a customized compliance plan for each child, but you also get to submit progress checks, much like you do with Invisalign. You can do progress checks, but these are real lifetime doctors that are reviewing it and giving you real-time feedback. There's 93% proven compliance with these appliances. There's minimal doctor chair time. This is really an assistant-driven process. Once you get familiar with it and comfortable, the assistant's running most of this. It's a high ROI with minimal lab fees. You can start as young as 2 years of age, so you're really capturing that patient early on. And this is it's a healthcare approach with a proactive approach rather than a correctional approach with Invisalign or braces later on. So I typically say this to the parents. I said, would you rather have a healthcare and proactive approach, or would you really, because I'm telling you these things exist and this is what's going to happen if we don't correct them, or would you rather have more of a sick care corrective approach later on? And most parents jump on it. Yeah, if you see an issue, let's fix it now. Let's jump on this now. So they really appreciate that we can start so early. There's efficient and profitable practice growth. Let's talk about it. Internal growth, we're expanding offerings to existing patient population. You're increasing the average patient value. So if you already have pediatric patients in your practice, this is a no-brainer. Put that questionnaire in there and just start going. If you have an adult-centric practice and you don't have a lot of kids, it's a good conversation to talk to the parents about where they are and about some of the issues that they present with, and talk about how we can prevent those in children by managing their growth and development and their poor oral habits early on. And so that's a great referral source as well. HealthyStart patients convert whole families to comprehensive care. So very rarely, and I'm not looking to take on or steal anyone's patients, I think the best thing is for each patient to have a good, high trust relationship with their dentist. If that's with me, great. If it's with someone else, I think that's wonderful. But if their dentist doesn't do HealthyStart and they want to come see me, I'm happy to see them. And a lot of times those patients will say, well, I think we just want to stay with you and do comprehensive. And I say, you absolutely don't have to, but you can. So that's always a positive source of referral. Existing Invisalign patients that you guys have understand the importance of aligned teeth. So it's very easy to confirm these, to convert these patients, because unlike your Invisalign patients that are going to have retainers and Viveros and those types of things, these patients that we're correcting their habits and then guiding their teeth into the proper position won't need long-term retention because the teeth are put in the proper position initially, so they don't need it. It also becomes a new referral source beyond traditional dental referrals. So I'll tell you, my number one referral is an ENT from a major hospital here in Dallas. I have pediatricians, ENTs, speech therapists. It just really opens things up. A school nurse, there's a school nurse in the public school down the street from me who refers several patients that she sees every month. Now, I'm not saying that because, oh, look at me, I'm awesome. I'll tell you what, guys, I'm actually not awesome. I'm very average. So I'm saying if I can do this, anyone can do it. But this just really opens up who can send patients to you. You can also get referral sources from patients that they don't want. I mentioned the pediatrician and the bedwetter. Well, he didn't know what else to do. He didn't know what else to say. Great, that's my key demographic. Send them to me. So it makes him look good. So it's a very positive referral for him. It's high margin therapy, so you can leverage the use of expanded duties of dental assistants. My dental assistant just absolutely loves children. She's in the thick of it. She knows the coolest movies. She knows the coolest toys. So she really connects with these kiddos. So it's wonderful. It's a large unaddressed market. We know 90% of kids are potential candidates. So I dare you to go out to eat, or I dare you to go anywhere where there's children and not observe their mouth breathing, their anterior tongue thrust, all of these habits that they have. You can't unsee it, and you can just start handing out your business cards. Just kidding. Or you could. There is an opportunity for you to be a first mover too, which is a major differentiator for a practice as well. So that's very exciting. Let's take a look at a few cases so you guys can see what I'm talking about here. Here we have this little girl who started off when she first came in. She filled out the sleep disorder breathing questionnaire, answered for moderate with, she was a snorer, she was a mouth breather, excessive sweating. Her mom also talked about restless sleep, waking up at night. We saw it 30 days later, 3.5 months later, what these follow-up results were. Every single symptom that she had improved, if not completely resolved. So when we have this girl walk in through the door and we see that she's snoring, she's waking up at night, she's hyperactive, she's mouth breathing, she has labor difficult breathing, excessive sweating, allergy, she has all these symptoms, she's talking in her sleep. All of a sudden, a very short 12.5 weeks later, she comes in, she's not snoring, she's not excessively sweating, so we're not changing sheets every day. She's not waking up at night. Imagine what what those parents are feeling. That completely changes the dynamic of the whole family. Not to mention, look how happy that little girl looks because she's getting a good night's sleep. Let's take a look at her brother here. Initially, he comes in, not quite as many symptoms as his sister. He's hyperactive. He's mouth breathing when he sleeps, some excessive sweating. He's fidgeting with his hands, and sometimes bedwetting. So he comes in with his sister 12 and a half weeks later, and he has, again, complete resolution or improvement on every symptom that is reported. So one thing I'd like you to notice on him as well, we have a very large overbite and overjet, and we also are really lacking space for number 26 here. He comes in 3.5 months later, and look at the improvement that we see just in the overbite and overjet, just from repositioning the jaw where it's supposed to be. We see this beautiful jawline that's coming down, and we see that there's actually created some space, creating the growth through the natural pressure, using the natural pressures of the tongue on those tabs to open things up and drive the mandible forward, that now we'll be able to take him through and guide that tooth into the proper position. This is really exciting stuff. So pre-treatment, here we see him, large overbite and overjet. We're bringing the mandible forward. We're resolving symptoms of sleep disorder breathing. After 3 months, things have improved, if not completely resolved. We're then transitioning him into the next appliance in the series. 6 months later, he's sitting at a 2 millimeter overjet and overbite, midline's intact with plenty of room to guide that tooth. That's unbelievable progress in 6 months. And as you can imagine, the family's thrilled. So beautifully straight teeth are no doubt important, but health and well-being are life-changing. So this truly is a dental solution to a medical problem. Now, I will tell you, I tell parents, of course I want your child to have a beautiful smile. I'm a dentist, of course, but I want them to have minimal overjet and overbite of their teeth, of course. But more importantly, I know if they have a minimal overjet and overbite and they have all 28 teeth, or the age of 12, they don't have wisdom teeth yet, they have 28 teeth in the proper position, I know what's going on with that airway. I know we brought the mandible forward and they have this nice big garden hose of an airway that they're taking air in. That's really super exciting. So let's take a look at the next patient in here. Again, he reported with mouth breathing, labor difficult breathing, some pretty serious stuff. Floors, which would mean pronounced of allergies, excessive sweating. He was a bedwetter. He goes through the appliances. Here he is in March of 2015, such a cute kid. This is Dr. Kraft's son here. He looks great, but you can see he has anterior tongue thrust. That's why we see the diastema between those teeth. Which we know, guys, even if we align those teeth, if we don't correct the habit, that tongue's going to open that right back up. So it's really important that we correct the habit first. Here he is, July 2016, corrected the habit of the anterior tongue thrust, aligned the teeth, closed the diastema, and he's great. He still does need a slight perfection of these teeth. He still has some permanent teeth coming in as well. But in case you didn't see that, from March of 2015 to July 2016, boom, I hope you guys are clapping for me on the other side of this computer as I'm showing these pictures. Not my case, but wonderful result here. You have to be happy. And here he is, April 2018, with permanent dentition in place, beautiful orthodontic result. Midlines are intact, and more importantly, no mouth breathing, no bedwetting, or very minimal bedwetting. He's completely resolved where he's supposed to be. So here's another patient here, courtesy of Dr. Robertson. Again, we are able to bring initially lots of symptoms that we have here: hyperactivity, excessive sweating, restless sleep, ADD, waking up at night, poor ability in school, wetting the bed, 5 pronounced, so I would assume that's 7 out of 7. Wearing the habit corrector, so we see progress here, and very quickly, we see how, excuse me, let me come back here, how quickly we can bring that mandible forward to resolve those habits, and just as simple in 30 days. Here, just to really show off a photo here, we have this lady with a very gummy smile. So what are we gonna do? What are we gonna do about that? We know by going through the series of appliances that we can take her from the habit corrector, recognize any poor oral habits that she may have, take her through the guiding appliances, and what a beautiful result that she has. And this was done very quickly as well. This was done, I believe, in 4 months to achieve that. So I know you guys are brilliant with Invisalign and you're doing these wonderful cases, but I'm not sure if Invisalign could give a better result for a gummy smile like this by controlling the eruption of the anterior teeth and allowing the posteriors to erupt. Maybe you can, but this is pretty exciting. So let's take a look at what these look like. Initially, this shows you what the appliance looks like in the mouth. We have a large overbite and overjet and underdeveloped mandible. This is initially what the appliance looks like, the guiding appliance. So they'll also wear, we're assuming that the habit's already corrected in this patient. We see here the progress with 8 and 9. We can see how this case goes through by wearing that guiding appliance. Yes, it fogs up. We love that. That means they've been wearing it. And then we can see the alignment of those teeth here in the finish and how beautiful that looks. So let's talk about some of the things that HealthyStart has that sets it apart from other things. HealthyStart app is adding to the 94% cooperation rate. The kids love it. Access to the app comes with every case that you sign up for. It not only allows the child to interact for positive rewards for being compliant, but it also allows your patients to communicate with you effectively by showing off the smile and taking progress photos. It's really a huge hit with kids, and quite honestly, it's a huge hit with parents as well, because we're really able to track their progress, which is wonderful. So let's talk about what you guys get for being at the AACA course. The next digital education course is starting July 8th. So this special will be available for all AACA members, whether you were in Vegas or not, up until this course starts at July 8th. So if you don't get it at July 8th, we're not going to be able to offer this to you after that. You're going to be able to get hands-on treatment of 2 full cases, including the treatment plan, the appliances, the specialty appliance cases, and the HealthyStart mobile app. You'll get a private AACA-specific live destination course of your choosing, which, let's be honest, that's always a good time. You get interactive AACA private study groups to go along with each presentation. You'll get training on pediatric treatment of sleep-related breathing disorders and identification in your patients, real action items that you can take back from the certification and get started immediately. HealthyStart will increase your patient flow. The course includes 1 doctor and 4 staff members, which is amazing, 18 CE credits, and then 16 more when you attend a destination course. So that's pretty amazing. The provider certification course, just so you know, it's centered around education, but also implementation. So both of those things, so you can get immediate results with this. It's so fun to stand around and talk about things and talk about theories, but it's quite different if we say, here's how you go back Monday morning and get started, and here's how you really make a big impact. And in my limited experience with the AACA as a newer member, I realized this group is all about implementation and impact. So these courses, these AACA private courses, will really be centered around that. Let's talk about this a little bit. Individual costs. So if you're not an AACA member, or if you don't sign up before July 8th, you're going to be investing $3,400 in a digital training course. An in-person training for doctors and 4 staff members is an additional $3,400, and then 2 lab cases is approximately $1,600. So your total investment would be $8,400, and that's still a great deal. But here's what they're offering you guys for a limited time. For the AACA special, so if you sign up before July 8th, you're getting the digital training course, you're getting the in-person training for doctor and 4 staff members, as well as 2 lab cases. And you can actually pick up the habit corrector at the booth. That doesn't apply because you guys may not be there. I realized that after I said it. So it will be mailed to you quickly. And all of that is for $3,400. So the total savings by signing up through AACA before July 8th is $5,000, which is amazing. So let's talk about what does that mean in your practice. Well, let's just be super, super average here. Not that anyone listening to this or that is in the AACA Gallerite group is average, but just stick with me. For a non-Gallerite dentist, let's say they get 1 new family a month. Okay, so 1 new family, let's say there's 1 or 2 kids in the family. So the typical fee for HealthyStart is about $4,500. So maybe you're getting $4,500 to $10,000 a month just by starting 1 or 2 kids and maybe doing their hygiene visits, okay? And a few other restorative needs or whatever. Stick with me. This just round numbers, very average. So for a year, that's an additional $5,400 to $120,000 a year in production just by getting 1 new family, okay? That's approximately 2 to 3 hours of chair time. You don't need to invest in any new extra equipment. You don't need extra staff. You don't need extra supplies. So just by starting 1 family a month, so just that non-Gallerite, blah, average dentist just starting 1 a month, the first month will cover the education, the investment in the education that you'll do at $3,400. So that's a pretty sweet deal. Now let's stop for a second because this is the Gallerite Nation. This is a group of high achieving case start machines, okay? So think about how many Invisalign cases you do each month. Now let's use that number for Healthy Start. Maybe even more since you'll be a first adapter in your area. Invisalign is super, super common in my area here in Dallas. Excuse me, so it's hard for me to really say, like, come to me, I'm the best Invisalign, because honestly, the girl across the street, she's an AACA member and she's way better than me, let's be honest, right? But with Healthy Start, maybe you're the first adapter, maybe you're the first one in your community, so they want to come to you because you're the only one offering it, which is wonderful. So let's talk about how we're going to make you $1 million today. Let's say the average Healthy Start patient treatment fee is $4,500. You're doing habit correction for about an hour and a half. That's 3 to 5 appointments, about 20 minutes a piece. Again, most of this is run by the assistant, not the doctor. Then we have orthodontic correction as we're guiding teeth into the proper position. That takes 4 to 6 appointments, approximately 20 minutes appointment. So that's about 2 hours. Less than 20% of the doctor time is required for the appointment. The average lab fee is $600 to $800. Additional overhead needed to start the first case is $0. So let's say you start 20 new cases a month, which I don't think is outlandish, especially for the Gallerite Nation. So additional revenue of treating 200 patients per year with Healthy Start is $1 million. So I hope that you guys are actually sincerely applauding me at this time, because I literally just told you how you can make an additional $1 million in the next year without hiring anybody or buying any equipment, which is pretty awesome. So I think that this is just a really, really amazing opportunity for you. So how do you get certified? Register for the Healthy Start digital course. Like I said, it starts July 8th. This is the time. You'll receive your first set of appliances for your 2 free cases as soon as you register. And then you can choose which live AACA event. Of course, you can come to any of the events, but I think knowing this group, you'll want to come to an AACA event specifically. So you can register now electronically at www.thehealthystart.com/AACA. We are so excited to have you on board. We're so excited for you to grow your practice, but more importantly, we're so excited for you to help children. Children are our future, and if we can help them become the best versions of themselves and unlock their potential, it'll be just an absolute great partnership moving forward. Thank you so much for your attention, and I can't wait to see you guys on the digital course starting July 8th or in person in the AAC event coming up very soon. Thank you, everybody.